Good morning, everyone. We've got 15 new cases again, 8 of them linked, the rest still under early investigation. 5 of the 15 were in quarantine during their entire infectious period, and we're aware that at least 9 spent part of their infectious period in the community. One of today's cases is a detainee who was tested positive yesterday. And Corrective Services Commissioner Ray Johnson is here and will answer questions on the great work of our correctional facilities in reducing the risk of the virus spreading. We have 10 people in hospital, so a reduction on yesterday's number, which is good news. 3 people in intensive care and 1 requiring ventilation. On the testing front, a drop in tests yesterday, a trend that we have seen on the weekends, 2,406 tests conducted. Now, we would like to see that number over 3,000 each day. So again, a reminder, please come forward for testing if you have any symptoms or if you have been at one of the identified exposure sites during the times that have been listed. That information is available on the COVID-19 website and also through push notification on the Check-in CBR app. On the compliance front, ACT policing continued to be very active yesterday, 468 traffic stops with 5 directions to leave the ACT. On the business compliance front, Police and Access Canberra have been focused again on business compliance and sadly the same issues remain. A small number of businesses, an increasingly small number, but it's still a factor, have staff who are not wearing masks properly. So we again remind businesses that one of the things we are striving for here is to allow you to operate and to trade, but part of this is got to have staff wearing masks properly. That is essential to being able to trade safely. Now, yesterday was probably the warmest day of the spring so far, and there were thousands of people outside enjoying that great weather. It's not quite so good today, but certainly still reasonably large crowds. What we are advising is to keep your distance from other groups and other people. Wearing masks and staying physically distant is the safest way that you can enjoy the outdoors at this time. So it's great to see people having the opportunity to get out. That's fantastic. But all gathering in the one spot and not wearing masks and being too close to each other is not so great. So please, the whole point of a lockdown is to reduce the risk of transmission. And the virus transmits when people are too close to each other, and it's more likely to transmit if people are not wearing masks properly. So just a gentle reminder on that point. Yesterday, on the vaccination front, another strong weekend day for the Territory. And over the week, 44,000 vaccination doses were administered to the week ending 10 September. 95% of our population aged 50 years or above have now had a first dose of a vaccine. And over 75% of that 50-plus age cohort have now received 2 doses and can be considered fully vaccinated. This is a very high level of vaccination, but it still leaves a pretty large number of older Canberrans who either haven't received a first dose or haven't completed their vaccination program. It is critical for people in this age group who are the most susceptible to developing severe illness if they contract the virus to become fully vaccinated as soon as possible. Now, the signs are good on first doses, but we do need people over 50 who are unvaccinated to come forward to get vaccinated. There is, of course, a considerably larger amount of work necessary to vaccinate younger Canberrans under 50, and this is occurring through both ACT government clinics and through our primary healthcare network. There is a significant difference in second dose protection between Canberrans aged 40 and over and those under 40. For Canberrans aged 35 to 39, the second dose coverage, so that are fully vaccinated, is currently at 29%. For Canberrans aged 20 to 24, the fully vaccinated cohort at the moment is just 15%. So it is going to take some time and patience before we get an equitable level of vaccine coverage across our entire community. It's worth observing that the single largest demographics in our city are those aged between 20 and 39. So this is the biggest number of people, the largest group that we need to vaccinate, and it will take some weeks. So before I hand to Dr. Coleman for an update on today's cases and the broader epidemiology of our outbreak, for those who've joined late, a quick recap: 15 new cases, 8 that are linked, only 5 in quarantine during their entire infectious period, at least 9 infectious in the community. So this is a number that is of concern. 10 people hospitalised, so an improvement on yesterday's numbers, and 3 people remaining in the wonderful hands of our intensive care units at Calvary and Canberra hospitals. I'll now hand to Dr. Coleman to provide that further update, and then myself, Dr. Coleman, Minister for Health Rachel Stephen-Smith, and Commissioner Ray Johnson will be available to answer questions. Thank you.
Good morning again, everybody, and thank you very much, Chief Minister. So, as the Chief has said, since our update yesterday, we have recorded 15 new COVID-19 cases. This brings our total cases for COVID for this outbreak to 493. With 254 of our cases now recovered as part of this outbreak, we have 239 active cases. So, of the new cases today, out of the 15, 8 can be linked to known cases or ongoing clusters where there is transmission. And of those 8, 6 of them are household contacts. Of the 15, only 5 were in quarantine during their whole infectious period and therefore posing no risk to the community. Of the remaining 10, 9 spent some time in the community for at least part of their infectious period, and 1 is still under early investigation. We have 10 people in our hospitals. They age in range, with our youngest patient being under 12 years of age and the oldest is in their 70s. 3 of these are in ICU, with 1 requiring ventilation, and our ICU patients are aged from 40 to 60 years of age. Of these 10, the majority are unvaccinated, as I report every day. 8 unvaccinated, 1 is partially vaccinated with 1 dose, and 1 we don't know the vaccination status at this point in time. So included in today's numbers is the case connected to the Alexander McConaughey Centre, the AMC. As mentioned yesterday, the positive status of this case was detected during routine testing that is undertaken upon admission of detainees to the AMC. The detainee has therefore been in isolation since their admission to the AMC. Through our investigations in the past 24 hours, all detainees and staff who were in contact with the individual and therefore considered a contact have been identified. Additionally, a number of ACT policing officers and watch house staff has also been identified as contacts. These contacts have all been advised and are receiving our ongoing support, as is normal with our process for following up cases. Furthermore, our Justice Health team hold a weekly clinic at the AMC to provide vaccination for any new admissions that are not already vaccinated. As of today, 74% of detainees currently in the AMC have received their first dose, and 55% have received their second dose and are therefore considered fully vaccinated. As I mentioned yesterday, we have comprehensive operational plans in place for our high-risk environments, and we've done an incredible amount of preparation work over the last 12 to 18 months. These plans were immediately enacted yesterday as part of our response, and we've had a really good operational outcome from that. We will, of course, continue to work closely with Acting Commissioner Johnson to communicate directly with those affected and provide ongoing support as the days go by. We now have just over 880 self-identified close contacts and almost 350 active exposure locations. But again, I remind you, please keep up to date with our exposure locations on the COVID-19 website, and please do what those directions and that information asks you to do. We have no additional active public sites of transmission to add today, and overnight one new case has been linked to the Busy Bees Childcare Centre. And so to conclude, my shout out today is actually to the mental health and wellbeing team. As we talk about so often, isolation and quarantine is actually really, really hard for a number of reasons, and it does affect everybody slightly differently. It can be especially hard, we know, for people who have tested positive. It can be a big shock because often we think that it can't happen to us. But also it can have an impact for those who are caring for someone who have COVID-19. This team are the people who spend a lot of time on the phones providing support to our cases, their families and their carers, as well as to the numbers that we have in quarantine. They are a massive part of our COVID-19 response and do an absolutely wonderful job helping people through these really difficult times and circumstances. So thank you very much to all of you. We offer all the support we can to you guys who are offering support to the community. I'll now hand back to the Chief for questions. Thank you.
Thank you very much, Dr. Coleman. Questions?
Good morning. You said yesterday you're not worried about vaccine hesitancy, but you were also talking about some Canberrans 50 plus who maybe haven't had their first dose yet. Do we know why those people haven't lined up for a vaccine yet, and are you worried about it?
Well, look, across the age cohorts, it's a very strong level of vaccine take-up. I'm appealing to those who are yet to come forward for a first dose, and particularly in that older cohort. It's a small section now, less than 5%, but nevertheless an important and vulnerable group potentially to severe illness. So our endeavours here are, given we've got significant AstraZeneca supplies, to utilise as much of that as possible for the age cohorts that it's recommended for.
Chief Minister, you mentioned the issue of business compliance. How concerned are you at the moment that that is going to jeopardise or have a negative impact on your plans to reopen eventually?
Look, I think what we're experiencing is not that businesses need to be told multiple times, but that as the compliance teams move around the city to different regions and precincts, there is, I guess, a continuing theme that is largely mask wearing. Once businesses are advised that, hang on, you're not doing this properly, the return visits that are often random and are focusing on non-complying businesses in the first instance are finding a higher level of compliance as a result. But this far into the pandemic, this far into our lockdown, it is still a source of frustration that message that most businesses are complying with and doing an outstanding job and taking very seriously. It's still frustrating and it's a recurring theme. Now, it's a small number of businesses, and if they're repeat offenders, then they run the risk of significant fines and the ultimate sanction of not being able to trade. But what the inspectors are finding is that an engagement tends to address the issue, And so when I give a daily update, I'm reflecting the advice and feedback we've had from the teams as they go around the city. And so, they have been in every single business district across Canberra, all of the major ones, and then fanning out into the suburbs in order to undertake compliance activities. And a small proportion have not been complying. They've been advised they're not. It is then corrected. They are then rechecked, and the compliance is much higher. But it is just frustrating, given how far into into this lockdown and the pandemic we are at, that we're still having these issues emerge. So I have this opportunity through this platform to remind people of their obligations and to reassure the community that we do have people on the ground enforcing the public health directions.
Chief Minister, the Prime Minister has just announced an extra 1 million doses of Moderna to arrive next week. Were you made aware of this before the press release went out, and what does it mean for the ACT?
No, I had an indication that there might be an announcement when he called the press conference. I understand it was at 11:30. It wasn't on ABC News Radio when I was driving in, so I haven't heard what he said. I'll have to catch up on that, but another 1 million doses is welcome. If it is on top of what was foreshadowed, we have been discussing Moderna's arrival for some time. So let me get briefed on exactly what the Prime Minister said. But obviously when he's standing up within a few minutes of me, it's not possible to get a full briefing on those matters.
And given that the Prime Minister is talking about international travel resuming in the next few months, I think from October, November, is now the time to push for a dedicated quarantine facility from the Commonwealth in the ACT so we can have that up and operational before those flights start?
Well, we've already raised that issue, and where we have been managing the return of Commonwealth ministerial delegations, that has drawn on our existing quarantine capability. So it will be a very sensible decision for the Commonwealth Government to make to facilitate their quarantine of their own staff and their own ministers. I do note, however, that there is a trial underway in South Australia in relation to a quite sophisticated home quarantine arrangement that may be the preference for fully vaccinated international travellers, and that might be an appropriate context, for example, for federal ministers to undertake their quarantine in that way in the future.
Chief Minister, Tanya Plibersek on ABC this morning noted that there was scope for interpretation in the National Reopening Plan, and that her argument was there's a role for the Prime Minister in helping First Ministers as they kind of set their own reopening plans according to their local circumstances. Has the PM played a role like this as you've set your reopening plan, and what kind of assistance or work has he done in facilitating that?
So not in a bilateral sense. The Prime Minister has been the chair of discussions in National Cabinet around the framing of the National Plan, and is chairing obviously the next meeting on Friday of this week coming. That will, amongst other items, be discussing a number of elements of what's described as Phase B, the vaccination transition phase, and Phase C, the vaccination consolidation phase. If you look at the National Plan, you will see it's got some high-level guiding principles and priorities, and then under the headings of measures may include a list of dot points. Some of which have to be determined after them. Some of that further detail will be the subject of National Cabinet consideration in the coming meetings. So the Prime Minister would have a role, along with other National Cabinet members, in providing some further detail. I think this does provide an important opportunity to, once again read directly from the National Plan and remind the community and remind the media that the plan says measures may include, does not say that it will, at any particular threshold. And so there is the detail that is provided there has a lot of to be determined after it, and is may, not will. And then the other thing that I think has not featured heavily enough in the national discussion of moving through each of the phases is the bolded point above the whole thing, which says, and I want to read this word for word, phases triggered in a jurisdiction when the average vaccination rates across the nation have reached the threshold and that rate is achieved in the jurisdiction. So there's a lot of focus on what New South Wales are going to do when they reach 70%. Well, New South Wales are not enacting the national plan if they do things at 70% ahead of the rest of the nation reaching 70%. Now, they are obviously entitled to make changes to their local restrictions, as they have been doing, and that's obviously their purview entirely. But the national plan is very clear that the nation needs to reach the 70% threshold and the nation needs to reach the 80% threshold. Those same constraints apply to the ACT as well. And based on the current vaccination trajectory, it'll be New South Wales and the ACT that will get to those thresholds first. But our actions under the national plan are limited by where the rest of the country is at. Now, having said that, I think it's important to note that whether the nation crosses, or when the nation crosses 70 and 80% is very highly contingent on the vaccination programs in New South Wales and Victoria, because together they are nearly 60% of the national population. And then the third largest jurisdiction that will impact this is Queensland as the next largest state. So it is possible, based on current vaccination rates, that the ACT and New South Wales will cross 70 and 80% ahead of where the nation will be. But under the national plan, we are required to achieve both thresholds. I think the Prime Minister described this when the national plan was released as it being a two-key turn process. Both things have to occur. And I think it's important that people understand that, and that the reporting of the national plan reflects that. It is in bold at the top of the national plan.
Chief Minister, just on that, with New South Wales seemingly pushing ahead with easing restrictions faster without the national average reaching those thresholds, and we see people like Queensland and WA having stronger positions on their borders, is the national plan either too vague or are the states too fragmented for us to push together as a nation in the next coming months?
Well, I think the plan was written in a way to reflect the different starting points of jurisdictions, that it was highly likely that when we got to this level of vaccination that there would be some jurisdictions that were managing outbreaks and others that were not. And that is why the two tests, the two thresholds, the nation and the jurisdiction, was explicitly put in place in order to provide that level of protection to ensure that we could stay as a nation. So the national plan is a very good plan. My concern has been how it has been misrepresented, grievously misrepresented at times in the media and by some politicians. The weakness that you have identified in it is that there's a lot of somewhat vague dot points that still have to be determined after them. What I can reassure the community is that further level of detail is the subject of both the next National Cabinet meeting and presumably the one after that, so that ahead of the time that anyone is going to get to the 70 or 80% thresholds, there will be a further level of detail available on exactly what that means. This, of course, has implications for the plans that each jurisdiction would enact as we transition to those points. So what we're thinking about for next week is based upon the more immediate term and will be influenced of course, by adherence to the national plan as it is written, which of course is 70% of the nation, 80% of the nation, and then the further level of detail that will be coming from the 2 national cabinet meetings that are going to discuss this in September.
Has the New South Wales government put enough consideration into the ACT's position when coming up with their roadmap, do you think?
I don't think the New South Wales government pays that much attention to the ACT, to be frank. When we seek to engage with them, it's relevant for the Canberra region, but no, what drives their decision making is Sydney, and to a lesser extent Newcastle and Wollongong. That's an observation that's been made, that's what New South Wales stands for: Newcastle, Sydney and Wollongong.
Chief Minister, you're soon to announce your reopening plan. As you're putting it together, to what extent are you factoring in the situation in New South Wales, and particularly, are you following their assumptions that hospitalisations in New South Wales will peak in October? Or if not, what are the various different kind of modelling or assumptions about New South Wales you're factoring in?
So yes, we are considering what New South Wales are modelling, what they're telling us through AHPPC and other intergovernmental engagement, what we're hearing through National Cabinet. There is a fact about hospital resources in southern New South Wales in particular, that there is a reliance on Canberra Hospital as the tertiary hospital for the region. The distinction that we draw really is cases in our immediate region and what would be the geographic area where you would anticipate a critically ill patient being transferred out of a smaller New South Wales regional hospital into Canberra Hospital. I've repeatedly asked the New South Wales Premier for assurances in relation to the state's capacity to look after their own as much as possible, but our planning does have to factor in there being some transfer from Queanbeyan Hospital, Bega Hospital, some of the other regional, smaller regional hospitals into our health system. That is lessened by good public health social measures in the regions. There's clearly a distinction between what happens in Greater Sydney, Central Coast, Newcastle, Wollongong, those areas. A lot of big hospitals with capacity in that area, a bit less so the further into the regions you get.
And are you accepting the assumption that hospitalisations in New South Wales will peak in October as well?
Well, we have no reason not to accept New South Wales health modelling of their own situation. We're not doing shadow modelling of the New South Wales health system. We don't have that, neither the time nor the capacity to be doing that. So we are working closely with the Southern Area Health Service, and in particular, and so we have factored in some flow of patients, severely ill patients, into our system. We anticipated this 18 months ago, and that's why we built the Garran Surge Centre, one of the many compelling reasons to have that facility available. Okay, Chief Health Officer, lovely, thank you.
Hi. Can you tell us whether the positive case, the detainee, was in court at any point?
I just wonder if maybe Acting Commissioner Ray might be able to speak to that. So we might defer that one.
Sure.
There's been 2 cases in Queanbeyan. I think they're going to be included in tomorrow's numbers. Are they linked to the ACT at all? Do you have any more information about the Queanbeyan cases?
So I was just showing the press release just before I walked in today. I'm not up on the details of that, but I'm sure that my teams are talking with the Southern New South Wales teams.
Chief Health Officer, we've been speaking over the last few weeks about the reproduction rate of the virus and also the trend. Can you give us an update on that? Is it still sort of trending positively?
Look, what I've committed to doing is talking to that on Tuesday when we provide a fairly comprehensive update of where we are in the ACT and also some details about what's happening with the lockdown moving forward. So if you can bear with me, we can get to that on Tuesday.
There's been discussion in New South Wales about discrepancy between the health advice from Dr Chant wanting to open up at 85% and the Premier pushing ahead early. As a Chief Health Officer yourself, are you comfortable with New South Wales opening while there's still such an outbreak? And with cases in the region, does that risk the ACT's position?
So I won't make any comment on New South Wales decisions, whether I'm comfortable or not. My job is to protect the ACT community, and part of that is keeping an eye on the conditions in the surrounding regional area. So we work very closely with our Southern New South Wales Public Health Unit colleagues and are very in sync around what the conditions are and how we can continue to work together to protect the ACT community.
And while other prison questions would go to the Commissioner, do you have any update on the status of the prisoner? Is he off-site? Is he on-site? Is he doing well?
My understanding is that he is comfortable and being isolated on-site. Thank you.
Morning all, afternoon all. Questions?
Yeah, good afternoon, Commissioner. Can you tell us, was the positive case in court at any time?
So the positive case passed through the court cell complex. They appeared in court via AVL, so they weren't in the actual court building itself. The facilities in which the detainee passed have since today been deep cleaned.
And we've heard about the precautions in place at the AMC, but what precautions are in place at the watch house? Was the positive case at the watch house at all? And was the detainee who tested positive mixing with other detainees?
So far as the police watch house is concerned, I couldn't comment. We took took custody of the detainee from police from the watch house. They were in the court cells with us. They were separated as much as we could from other detainees. They were transported with other detainees were now isolated as a result of that contact.
How many corrections officers or other detainees need to be isolated?
We have, at this point, 3 detainees and only 1 corrections officer as a casual contact as a result of the protective equipment that all our staff were wearing as a part of the normal practice for handling detainees.
And are you able to provide a bit more information about the prison status? Is it in lockdown for X amount of days because there's a case being identified in there? Will everyone be required to get tested? How does that work in the coming days?
So at this point, the detainee came through the admissions process and has been isolated since arrival. Everyone in that process has been wearing PPE. So at this point, the facility was locked down yesterday. Give us a chance with health to work through the processes to make sure that we didn't have a further spread, and then we dealt with anyone who'd been in contact. Today, on the basis of advice from health, we're going to start the unlock procedure. But note also, as a result of planning, as a result of the current situation, we have had restricted visits and other things going on at AMC to ensure that we maintain safety of both detainees and staff. So we will return to that status, which won't be full return to normal business. It'll be returned to the previous arrangements.
Commissioner, what are the restrictions that are enacted at AMC in response to this positive case?
So in terms of the positive case, so the facility was kept in lockdown. So detainees were kept in cells to the extent we could, pending the issue of medicines and other things and appropriate care. And that was the primary next step we took to allow us time to work with health to determine who, if anyone else, had contact with the positive case.
Did the positive case come into contact with any individuals after they arrived at AMC?
No. None that weren't in PPE.
And are detainees ever tested at the ACT watch house? And if that's the case, did this occur in this particular incident?
Again, that'd be a matter for police to answer in terms of testing in the watch house. I'm aware that they do, but I'm not sure what the protocols are for them to do it. But for us now, all admissions into AMC are tested and isolated at least until we get the result of the first test, and depending on the circumstances, potentially quarantined for 14 days. Thanks.
With less than a week for the mandate to come in for aged care staff, do you have an update on that? And are you confident that we won't need to stand down any aged care staff once the mandate comes into place this week?
I don't think I've got updated numbers for aged care staff today compared to previously, but just give me 1 second, I'll have a look. I'm really confident that there has been very strong take-up, but I have got numbers from the 8th of September. That tells me that, according to the Commonwealth's figures, 92.3% of staff in residential aged care have had 1 dose of the vaccine, and 70.6% are fully vaccinated with 2 doses. And so we still have a little bit of a way to go. We haven't seen the speed of increase in that next period as we did when we went very, very rapidly from 44% to 88%. It's that speed of increase has slowed down. But what I am told is that take-up at the vaccination hubs and clinics that have been specifically offered for staff has still been good. But obviously we will be doing a final push to ensure that we can get as close as possible to 100%.
Roughly how many people does that remaining 7-8% account for?
So the total number of people is almost 3,000. So if I was the Chief Minister, I would be able to tell you very quickly what 8% of 3,000 is. It's somewhat less than 300.
Minister, is there a role for rapid antigen testing to be used in relation to detainees? I know this is something that crosses jurisdictions, but is rapid antigen testing something that you as a health minister and generally as the ACT government is something that you're interested in supporting or looking into?
Yes, look, that is a conversation that I have had very recently, actually, with Dr. Coleman about the potential use of rapid antigen testing in certain settings. As you would be aware, the previous conversation about rapid antigen testing has been that it's difficult and not very helpful in an environment where there's not community transmission of the virus because it's not as reliable as the full PCR test. But we're obviously in an environment where there is a level of community transmission, and so that is very much an active conversation within the AHPPC and internally as well here around what the role of rapid antigen testing would be. And I think the type of settings that you're talking about when people are coming into custody, for example, are exactly the type of settings where you might think that's a really useful tool because you know, with all the PPE as well, that's very, very important, but it's that extra level of protection and safeguard. And Dom, I'm thinking about 240 as the answer to my question of 8% of 3,000.
And then, so about a week ago, we were also speaking about disability sector and the vaccinations there. You mentioned that there was an increase in vaccinations, but wasn't as fast as you would have liked, and we're trying to combat initial hesitancy. How has that gone since the latest figures?
In disability? Yeah. So, again, I've only still got figures from the 3rd of September, the latest figures that I have there, so I don't have any update on that for you. What we've certainly seen, as I've said previously, is that really strong response from the disability community itself to get out there, leaders getting out there and encouraging people to get vaccinated. And I would just take this opportunity to encourage people. We've also, as I've previously mentioned, had a really strong, a positive response to our access and sensory clinic, and that is now booked out until the 4th of October, but appointments there are available from the 4th of October.
Just a quick one about this detainee. The Commissioner wasn't able to provide any details about what is in place at the Watch House to make sure that if a positive case comes in, the virus doesn't spread. Can you give any clarity on that, and can you give any clarity on what the movements of that detainee was in the watch house?
Look, I can't provide any comment in relation to the movements of the detainee in the watch house. What I can do is reiterate what Dr. Coleman said in terms of the really positive feedback that we've received around the use of PPE, the small number of contacts resulting from that really strong use of PPE, the small number of close contacts that are identified. I was advised this morning that testing is offered in the watch house. Obviously, we can't require people to get a COVID-19 test in that environment. People are offered, though, as people come into the watch house. So, yeah, but it sounded like, from everything I've heard so far, that the processes that are in place have served us really well.
Sorry, just lastly, that access and sensory clinic, how many bookings or appointments rather does that take in a week?
Look, I'll have to get back to you with that number. I don't have that in front of me. Great, thank you.